Response for C, let's see here. Okay, so let's dig into this a little bit more. So the question, by moving skeletal muscles and by alternating pressure on the abdominal and thoracic cavity by breathing, you pump blood in the veins through their valves back toward the heart. So first of all, what is this describing? Which of our mechanisms is this describing? So this is both the skeletal muscle pump and the respiratory pump, right? So both of those are being described here, as well as the location of valves, the concert of the skeletal muscle pumps working with valves. The lead of the question, which is not a result of increased activity of these pumps. So all of these mechanisms, the skeletal muscle pump, the valves, the respiratory pump, are working to do all of these except which one? And so many of you selected C, but C is not the correct answer, right? Because the skeletal muscle pump working with veins along with the respiratory pump does increase end diastolic pressure. Remember, end diastolic pressure is the pressure with which blood is moving back into the right side of the heart, okay? It's synonymous with end diastolic volume, right? So the end diastolic pressure is that increased pressure of blood going back into the right side of the heart, and that is increased via the action of the skeletal muscle pump, the respiratory pump, and then the assistance of veins working, valves, working with the skeletal muscles. A, increase in venous pressure is also a response that happens as a part of these three mechanisms. B, increase in mean arterial pressure is the ultimate response, right? Remember, we're working to bring about that change. More blood going back into the right side of the heart, more pressure of that blood going back in the right side of the heart, more volume filled into the ventricle, end diastolic volume, more blood being ejected, which is all working to increase mean arterial pressure. So A, B, and C are changes that are brought about by skeletal muscle pump and the respiratory pump. But then increased venomotor tone is a very specific change. It has nothing to do with skeletal muscles. It has nothing to do with the respiratory pump. It has nothing to do with the valves, okay? Really important. It's a separate mechanism of its own. It's the action of the sympathetic nervous system on the smooth muscle that lines the veins, and that increases the amount of push on the blood inside the veins, and that increases venous return, okay? So the answer here should have been D. So increased venomotor tone is not a result of the increased action of the skeletal muscle pumps, the respiratory pumps, or the valves. They're separate, different mechanisms that are all working to increase venous return. Okay, let's look at another question here. And if you need clarification, please feel free to stop me or just drop a question in the chat. I'm going to relaunch the poll here. Okay, last few seconds. All right. So what are the three factors that completely determine mean arterial pressure? And a lot of response for A, which is correct, heart rate, stroke volume, and then total peripheral resistance. Excellent. And I'm glad no one selected B. B kind of looks right, but heart rate and stroke volume are what produce cardiac output. Okay, and then TPR is missing there. Okay. So the answer here would have been A. Let's look at another. All right, last few seconds. Okay. All right, so a lot of response for B, excuse me, but quite a few persons selected A. So let's see, how do arterial baroreceptors help change mean arterial pressure? And so B is the correct answer, which most of you selected, by sending signals to the central nervous system to change hormones and autonomic signals, right? I want to kind of explain why A is not right. Some of you selected A by sending signals directly to the SA node to change the heart rate. So remember, this is a feedback loop, or a homeostasis loop rather. So basically we've got signals being sent from those baroreceptors, not directly to the SA and AV node, but going through the brain, right? They're going to send those signals to the integrating centers, and then the integrating centers will send the relative corrective responses to the effector tissues via hormones and autonomic signals, okay? So A looks a bit tempting, but remember, it's not going immediately to the SA and AV node. It's going to go through the brain and then have a response via the autonomic signals and hormones, okay? So the answer here would be B. Let's look at one final question. Okay, let's take a look here. So when a person stands, mean arterial blood pressure can fall and the baroreceptor reflex is activated, which is a change associated with this reflex. So most persons selected B, which is vasodilation of the arterioles, and B is not the correct answer. So let's kind of go through each of these here. So A is a decreased compliance. Well, actually, let's explain why B is not correct first. So we don't see vasodilation of arterioles, right? Remember, if we have a drop in blood pressure, according to what we just drew out, if we have a drop in blood pressure, which would be hypotension, right? That's a signal that we're picking up. What we're going to try to do is increase mean arterial pressure to correct that change. And so vasodilation is not the response we would see generally on arterioles. We would only see vasodilation if there is a state of exertion to, say, skeletal muscle and to heart specifically. But everywhere else, we would see vasoconstriction, right? Taking that blood, sacrificing that blood for the sake of maintaining mean arterial pressure, increasing flow to the heart and flow to muscles. So B is not correct. C, decrease in stroke volume, is also not correct because, again, in coordinates with increasing mean arterial pressure, we would want to see an increase in stroke volume. And then D is also not correct because we would tone down or decrease parasympathetic activity, which would increase the SA and AV node firing rate, which would increase the heart rate. And that's the change that we would want to see. And so the right answer here is a decrease in compliance of the veins. And that is synonymous with that venomotor tone. And that is a change we would definitely expect to see because that would help with venous return, which would help with stroke volume, which would help with correcting that mean arterial pressure. Okay, so A is the correct response here. This is a change we would expect to see. The others are not a change we would expect to see in the face of a drop in mean arterial pressure.